You might have had labs done and been told your numbers are normal, but let's break down what that actually means. Let's get into it. I'm Nurse Vindira with By Individual Health and Wellness, and I'm a board-certified functional nurse health coach. So we're first going to talk about the conventional ranges, and then we're going to talk about the functional medicine optimal ranges, which I do want you to pay attention to. So your A1C shows your average blood sugar over the last 2 to 3 months, and here's a scale. Below 5.6 is considered normal. 5.7 to 6.4 is considered prediabetes, and then 6.5 and up is considered diabetes type 2. Fasting blood glucose is your blood sugar after not eating or snacking or drinking liquids, water is okay, for 8 hours the minimum. Normal levels are 70 to 99, pre-diabetic levels are 100 to 125, and then diabetic type 2 levels are 126 and above. A diagnosis is usually given if both of these lab values are elevated over 2 tests. And I don't want you to be self-diagnosing yourself. I want you to just be aware and reach out to your provider if you need further testing. And this is the thing. You can still be within range and still have symptoms like fatigue, sugar cravings, brain fog, because your body's still trying to compensate. So now I want to talk to you about the functional medicine optimal ranges. A functional medicine optimal range is going to be slightly different than conventional ranges. For example, for A1C, you want it to be less than 5.3. And then for your blood sugar levels, you want it to be between 75 to 90. And then looking beyond all of those numbers, we also are going to ask you, how do you feel? What's your lifestyle like? And are you trending in the wrong direction? For example, is your A1C trending upwards? And are your glucose levels trending upwards? We need to find patterns. Looking for patterns is really important. Check out your past labs and compare it to now. And get your baseline if you don't have them either, just to see where you're at. I hope you found this video helpful. Be sure to like, follow, and share with a friend. I'll see you in the next one. Thank you and take care.